Good evening, friend.
Good evening, Community Board 9.
Right. I'm over here getting it together.
Mm, Good evening, Mia. Good evening. I haven't seen you since last year. You muted.
I said, I guess I have to turn on my camera then.
Yep. There we go.
Right. There we are. Okay, got it.
You want me to put the thing behind you, babe? You right? Give me 1 minute, Mia. Good night, Mr. Purate. Because he's muted. Ooh. Mia, did you buy another dog yet?
Yes, we actually got one. We got a Dachshund, the hot dog. Her
What,
name
a
is,
hot dog?
yeah, her name is Lady. She's something else.
Wow.
I'll send you a picture.
Okay. Happy New Year, Mr. Purate. Hello, Cecilia.
Good evening. Happy New Year, everyone.
Can you hear me now?
Yeah,
Hi,
I
good
can.
evening.
All right, good
Good
evening.
evening.
Happy New
How
Year.
are you?
Happy New Year, everybody.
Happy New Year. Happy
Happy-
New Year. How the
It's
family
all-
doing, Cecilia?
And it's already starting on the good foot. Brittany was released, as you well know.
But she has been living since last year.
Yeah, and Senator Warnock won the Georgia election.
Mhm.
So we're kind of sitting pretty.
Mm.
If only the House of Republicans had changed, but that's all right. We'll live.
How the family, Cecilia?
Oh, family's doing pretty well. No complaints over here. My my daughter's sitting down, about to watch one of her favorite shows for a little bit, and I'm 24 weeks, and so far so good. Having a
You're
boy.
24 weeks?
Yes, pregnant.
Wow. No wonder why you are glowing and you look so youthful.
Oh, well, thank you. I feel tired
You don't
all
look
the time.
You
But
don't look
thank you.
tired though.
Oh man, I hit the slump right around 3 o'clock, and it's like I'm sitting in the office at work, like I don't think I'm gonna make it. But yeah, so we hanging in there. Everything's good. We blessed, which is enough for me.
Wonderful. Wonderful. Yeah, we have to talk. Remember to call me because I have so much going on I have so much on my plate, but remember to call me because we spoke about this thing for the hospital.
Yeah,
Yeah.
yeah. I thought I wrote your number down correctly, but I didn't. So then I sent an email, and I knew it was the holidays and stuff, and so I figured.
Do you have a pen
Um,
close to you? Have a pen nearby?
I think so. Hold on one second.
It's a period. You are 2020, 2016.
I'm sorry, say that again.
You have 26.
Yeah. That's because I was a Cavaliers fan back in the day when they won the NBA championship
Okay,
in 2016. But I'm not looking back, so I'm trying to look forward.
Wonderful. So we will. So my number, Cecilia, is 917 763 9284. Yeah, and if you need to reach me at any time, you can always contact the board office and they'll give you my information. If you're muted though, so I can see your mouth moving. I can read lips.
My bad. Yes. Okay. No problem.
Good night, Alexandra. Happy New Year. Yeah,
Oh my, oh my. Oh. Okay. Good night, everyone.
good night. How are you?
Okay.
That's good. Happy New Year to you and your family.
Well, thank you. Same to you and everyone else.
Yeah. Okay, so it is 7:05 right now. Usually wait until 7:05 to start. So welcome to each and every one of you. 2000, well, let me not say 2000, 2023. So much have happened in 2022. So much happened. But guess what? We have to be grateful that we live to see, to step into 2023. There are so many people who got to the edge, to the border. They put one foot in and the other foot didn't go in, didn't make it in.
Oh,
But we are grateful
yes.
that we made it. We have our families with us. Some of us may going through some pain, you know, stuff happening, but nevertheless, you know, we are here. So happy New Year to each one of you and wishing for you great things for 2023. Great things, happy things for you. Better things for 2023. And may
Hope you're right.
2023 be a better year for us. And as everyone knows that my name is Francesca Leopold. You're free to call me Fran. And I'm the chair for the Health and Social Services and also the second vice chair on the executive board. And I'm just gonna allow everyone to just, you know, just say something, just introduce yourself and just say something. This is our first meeting for the year. So I'm gonna start with our assistant district manager, who is capable of running and keeping us tight up and running the office like a giant. So, and we want to thank you for all that you've been doing, all that you will continue to do at the board. Go ahead, Mia.
Dear friend, welcome back everyone and Happy New Year. Happy to be back. Kind of struggling a bit first day back after the holiday break, getting back into rhythm of the work schedule, but happy to be back nonetheless and hopeful for the spring meeting session, getting some stuff done.
Right, Mr. Puritt.
Good evening and happy New Year to everybody. I joined the board. I'm sorry. I joined the board when they had the new session, and so far so good.
Okay, so we are losing Mr. Puritt. I think he's
You losing me how?
No, I couldn't hear you. Maybe the internet is on my side. Maybe
Okay.
the problem is on my side.
Okay. Well, I too am looking forward to a progressive 2023. I look forward to the collaboration between us. I want to follow up on a project I started last year with the ADA compliance. I did a little work with that, and
Okay.
I'm raring to go. And I got a neighborhood newsletter that I put out that I'm putting out in about 2 weeks, and I hope that I can get them in your hands.
All right.
You can see what we do over in Prospect Lefferts Garden. Anyway, I want to wish everybody a happy New Year again, and good evening. I look forward to the new year.
Thank you. Thank you. Alexandra?
Yes, I'd like to say good evening to everyone and a very happy and healthy new year to each and everyone, and hope that this was going to be a very productive year.
Thank you. Mina?
My name is Lute.
We are losing you. I don't know if it's me, but go again. Can you all hear her though? Because I can't.
No, I can't hear her. It's going in and out, Gabby.
Yeah.
I don't know.
Oh, that's better.
That's clear.
I just clicked. Well, hi, I'm keep it short.
I didn't know what's happening. I'll hear from Cecilia.
Oh, sorry. Hi, everyone. Happy New Year. I just, like everyone else, I hope that, this year is filled with, peace and prosperity. And I'm looking forward to seeing what 2023 has for us.
All right. Mr. Almoner is just joining us. Mr. Almoner, Happy New Year again. And just if you want to see introduce yourself and just share something, just say something short. We have muted Mr. Almoner. Mr. Almoner, can you hear me? So I think Mr. Almoner is trying to unmute himself or something. I don't know if you can. Anyway, so when Mr. Almoner get himself sorted out, then we will, we'll hear from him. So I just want to share a little something of gratefulness. Gratefulness. I know it's health and social services. So just to share on my side that we have to be grateful for the good and for the bad. In the earlier part of last year, my husband was scheduled to have a surgery, which is he was scheduled to have a hip surgery. And December 1st, we came to the hospital and he had his surgery. He got up and he was elated that the surgery went. He's like, wow, I'm up. He spent 6 hours in surgery, but he was just elated when he got up and said, wow, it was successful. I would do that again. And lo and behold, and he was maybe would have spent maybe a week at the hospital with rehab and everything. And 3 days after the surgery, he had a stroke. And so that set things back. With the stroke came pneumonia. After the pneumonia, infection step in. And to make it worse, he contacted COVID. Following COVID, pneumonia again. So where I'm sitting here now, I'm sitting by my husband's bedside conducting a meeting. We're in a room where there are 2 beds, so I'm in a corner and he's in his space because I try to make sure that I'm here for him, that he's okay in the night, But in all, persons may, wow, you're going through so much. But I'm not saying it that I'm going through so much, I'm saying it that I'm blessed. The reason why, because he's alive. In spite of everything that he's been through, everything that, he's very frustrated because whatever he came here for, it was successful. He's healing well and everything. And then the setbacks that came. But whilst I'm sitting at the hospital with him, there were so many codes that was called, not only with persons who were coming in, but on staff members as well. And he was here from December 1st, and persons who came after him did not make it back home, but he's here. And I'm grateful. I'm grateful. So in all that we do, in the pain, in the disappointments, instead of us sitting and seeing the negative, let's pick out the positive from it. Because that's the only way we could move on. That's the only way we can reach our goals, not concentrating on the negative, but
Amen.
going with the positive. So I'm here. I had a meeting last night and they were like, "You having a meeting and you're in the hospital?" Yeah, why not? I'm here. If I'm home, I won't be able to concentrate because I'm wondering what's happening at the hospital, but I'm here, you know? So I just want to share that with you guys for this new year, whatever comes your way, no matter what it is, be grateful. Look for the positive in the negative and move on.
I heard something very positive the other day that it goes, it's not the problem, it's our reaction to the problem.
The problem, definitely. Definitely. Thank you, Kayla. And Happy New Year and welcome. Thanks for being here. Mr. Malmana, can you hear me now?
Yes, I can hear you now. So I'm having some audio problems, so I can hear you now.
Wonderful,
Okay.
wonderful. So I just wanted to share that. And I don't really usually I have an icebreaker, and that's my icebreaker. That is my icebreaker. So we don't have a whole lot to share. So if anyone just wants to say anything, please go ahead. I know you have already introduced yourself, but based on what I've just said, if anyone to make a comment, which is Mr. Purity already just made a comment on that, which is very powerful, very profound. So if anyone wants to say anything, go ahead.
I just want to say thank you for sharing. And, definitely you and your family will be in my prayers, and, that, you have the strength to continue to be there for your husband, but also for you, that you get the rest you need to take care of yourself as well.
Thank you. Thank you.
I got a question relative to the senior day party.
Hold on a minute. I'm not getting there yet. That's on my agenda. Go ahead,
Okay,
Minor.
all right, I'll wait then.
Yeah, go ahead,
I'll
Minor.
wait. All right.
Thank you for sharing that. It just shows why we have to be, why we have to like this committee. Because there are things like this and we just have to, anything that can help people by actually going through this.
Minor, do you want to turn off, just switch off your camera? Let me hear if I hear you better, because I'm hearing every other word.
Yeah,
How's
same
that?
here.
Is this better?
Still muffly. I think sometimes we hear what you're saying, and then it's just like when you move, then we lose you. I don't know why.
Yeah, the volume just go. It goes up and down. Minor, maybe
Yeah.
you want to just come back out of the meeting, leave the meeting, come back in, and try that.
Yeah. So while we're waiting for Minor to come back in, if anyone wants to say anything else pertaining to, if not, then we'll move on. And when she come back, she will I'm monitoring this screen. So if anyone unmute themselves, then I'll acknowledge you. So we are looking at our outreach committee. I don't have my I don't have my notes with me. Based on the last meeting that we had concerning our outreach and what we are looking to do when it comes to outreach. I know Mr. Purity did send out the minutes. I will have to bring it up to see what we have pertaining to that. But nevertheless, there are quite a few things that I would like us to do this year And as I've said before, those of you, whoever have any, Minor, say something, let me hear. Minor, unmute yourself. I guess you can't hear me. Okay, so we have the
I
seniors.
hear you. Can you
oh.
hear me better now?
Yeah,
Yes.
Okay, I'm using the cell phone as opposed to the laptop. I don't know what's going on today.
okay.
Thank you.
Yeah, so you were saying something before you got, you was making a remark?
No, I
Okay.
was saying, thank you for sharing your story because it just shows how health, how this committee could help the community and the different things that, like, we just need to get word out with different things.
Yeah.
So thank you.
Yeah, you're welcome, definitely. So the areas that I'm looking for us to work on this year, as I said, that I don't have my notes with me as to the discussion last year when it comes to the outreach committee. So I would really like us to really engage with the seniors, the senior centers. A lot of the senior centers, they will close. So I would like for us to, I had a breakdown of everyone for each of the committees that they would like to, because I know someone will be volunteered to work with Mr. Pruitt. And then with the seniors, I don't remember. I really don't want to take the time to go into the minutes right now. Usually I would print the minutes and I would see, you know, what's Mr. Pruitt. And Mr. Pruitt, I just want to say thank you so much for, you know, sending out the minutes, putting those minutes together, you know, and sending it out on time.
Well,
I know
I
sometimes
appreciate it. I'm often
yeah, I just
confused.
thank you for the work that you do with the minutes. And as anything, as Minor has agreed to work with you. So if at any, you know, sometimes you may be busy or you may have to go to the doctor or anything and you're running late, you can always connect with her. You could exchange numbers and then, you know, you can work together to get the minutes out,
Okay.
because you have someone to work with you. Okay.
Okay, I'll
So
keep
I
that in
thank you. I
mind.
thank you so much for the work that you are doing. So we have a mental health in our community. It's rampant. It's really bad in the community. And we need to figure out a way that we could have a forum. Maybe we can connect with the other community boards, maybe community board 17, community board 8. We connect with them and have a forum, you know. And also, I would like for us, even when we're having the forum, to invite the police, you know, to come in, because most of the time, persons would always say that, you know, the police, they don't know how to deal with persons with mental health. So when they're acting up, when the police gets there, some of them do have the training, but I'm not sure for all of them. So we definitely would like them to be on board to hear what they have to say in terms of when they have to interact, when they are called to a residence, even on the street, and then they are encountering with someone with mental health. And how do they identify someone to see that that person has an issue, that person has some sort of a mental health, and they're just not behaving, you know, just wanting to be bad, you know, if to put it in those terms. So that's one of the areas that I'm looking at. And then also we have so many young persons in the community with nothing to do. And I know that is and we have education, we have the youth, and then I am not certain as to what we can do when it comes to social services, when it comes to them, what the areas we can work to help them, because those young kids, they are on the street, they're just getting themselves involved in mischievous stuff. And I would really like to find a way where we can have the Explorer, and I'm going outside of our spectrum as to what we're doing for health and social services, but these are the things that I'm looking at. And then we have our maternal health. I want us to concentrate on maternal health this year, have a big forum. As I've said before, I would like, I spoke to Assembly Member Cunningham. I have spoken to Council Member Rita Joseph, and then Farah Lewis. They are all on board when it comes to doing something big, some big roundtable or something when it comes to maternal health. And I know Kings County is on board with us, and I'm sure there are other health organizations who would like to be on board with us, so we can, and may we not just do it at one time for the year, maybe we can do it, twice for the year, and, just bring people, persons who have had issues. And as I said before, the first time that I did it, it was on a very low scale, and Congresswoman Yvette Clarke, she attended, and some of the material she included in the bill that she passed when she came, she said, I'm working on this thing and I don't have anything, and I'm going to use some of what you're bringing on your discussion in my bill. And I was very much impressed when I read it that she used that. And then we are looking at AIDS in our community. Now, all those things that I'm giving, these are things that I'm looking for us. That's our planning for the year. And if you have anything, please, unmute yourself, and that we can put it on the agenda as well. Because Mr. Pewitt, he will have everything in the minutes. Right?
Well,
And then,
oh, sorry.
And at the end of the day, so we're looking at HIV in the community, and a lot of young persons in our community with HIV, but it's just been swept under the step. Nothing much has been done. So we need to come back out and bring it up and educate our young ones, our youth in the community when it comes to HIV. And then we are looking at our senior population. Our seniors population, those who are in the nursing home and the shelters, as well as those who are home. So if we can partner, since we don't know everyone, so the only way we can tap into them and reach them is to reach out to the different block association presidents, because they now will be able to work with us and give us the information that is needed, and so that we could find out what type of services that they want. What can we do? I'm looking at I saw an email whilst I was sitting at the hospital, and they sent me something concerning a budget for non-for-profit. And then this is something that I have to talk to the treasurer for the board. And so we could see if we can put in for some funding. I'm not a grant writer, so I don't know if we have any grant writers here. Persons could put pen and paper together. You can make it look really pretty, that we could send out an application so we could get some monies, for our committee, so that we can, because there is not much money that's the board, whatever monies that goes to the board, we can't use it. So we have to do whatever that we do, it have to be through friends of. So we have to look for a way that way we can bring in monies and put it in friends of. So during the summer, when our projects, when they start doing stuff, at least we have some sort of funding, that we can start doing something with. Because we didn't do anything for the seniors last year. And so I'm looking for us to do. I wanted to do a trip. I wanted to do a pampering day. There was so much that I wanted to do with them, but we were not able to do it. And one of the reasons why we were not able to do much for them because of funding. We're looking at COVID, but then also we're looking at funding. We didn't have funding as well. And if there is any way at all, anything that we can do to raise some funds, anything. So any ideas that you'll have, shoot.
So I got a question, Ms. Leopold. Not so much an idea, but based on a little research I've done, there's something like 17 senior citizens or daycare facilities in our neighborhood, in the CB9 neighborhood. And I'm just curious, with such a fluid number where so many people are coming and going, how do we approach them to let them know that we want to? I mean, is it a matter of picking the biggest facilities and going after them, or is it a process of just? I mean, how do we approach them to make our pitch that we would like to represent them or we honor them in a day festivities?
When I first became chair for the Health and Social Services Committee, I started connecting with the different senior centers. And lo and behold, they were amazed. They didn't even know. Well, I was serious when I called them. They thought it was, somebody just playing some game on them, because they were like, in all the years that they've been in operation, it was the first time that anyone from the board had connected with them, to try to help. So therefore, we have connected with Bledman, Christopher Bledman, Shalom, St. Gabriel's, Fenimore, and we have also Ebbetsville on board, and there are some other ones in the area that I have to liaison with the board office to give me some of, because some of them the board don't have the information. They may be there. So usually the only information that I would get concerning any of those facilities, they would be with the board, and the board then would pass it on to me. So if you know of any of those in our district, they have to be in our district, not outside of our district, because we cannot go outside of our district. So if you know of any place and you have the information, feel free to pass it on. You could email me or send it to the board office, or whatever, just pass it on so that we can reach out to the directors and find out what's happening. Because what I did, we checked the facilities, we sat down with them to find out what the needs were. And Mia can correct me if need be. I think one or two of them, when we did the budget and we did the need assessment and everything, and we did the budget, we put them into the budget, and then they got monies, right? And I think Shalom received money. And Mia, was it just Shalom? Did St. Gabriel's receive money as well?
I recall that they received an allotment, but I do not remember what it was. I know for certain Shalom was able to get their floor repaired,
right,
and another request satisfied that they had asked for.
Right, because Shalom asked to repair the floor. They wanted chairs, they wanted steam tables, and some of the other facilities they wanted smart boards for the residents, and there were different things that they were asking for. One of the facilities we know for sure they are facing a lot of problems, which I have discussed with you guys before, is Fenimore. Because Fenimore, when they started that facility, that senior center, they started it with the church, and whoever was running the church initially, they gave it up and they just passed it on to an individual who have been running it on her own, and she get discretionary funding from the city, which is from Borough Hall, and whoever the council member is. So I know that Matthew Eugene really helped them, as well as Eric Adams when he was there. But then the whatever monies that they were getting, they were only getting $18,000 a year to run the facility. So many a times you find that Joan, I don't remember her name, but the lady in charge, her name is Joan. She used to have to take monies from her pocket to buy food. Sometimes they had only juice and crackers. They had nothing, so they really need help. So what I'm looking for us this year, I know a Department of Aging have been trying to help them so that they could be part, because Department of Aging do help, because even for Shalom, Department of Aging gave them, bought them a van. So they have a van whereby they transport the seniors, and then Shalom in turn would help. And when I connected with them, whatever foods that they had left back, if they have any excess of food, then they would send the food to the facility, to Fenimore. But sometimes they have their own thing doing, and they wanted Fenimore to be in a position to come to them to pick up the food. And Fenimore, they don't have, I think they have a van, but they don't have a driver. So when it comes, I think their issue really is financing, So we have to work with them this year to see how best we could help them. Because when I've been there to them during the day, and there's a long line outside when they're giving food on any particular day, and it's not a whole lot of food that they're getting, So we have to, and it's gonna be worse because there's a drought now. We don't have too much food. Cunningham, Assembly Member Cunningham went upstate last year, and he took a tour on all the farms and stuff, and we are in trouble. The food is, the farmers in planting, there is not much happening. You know,
Ms.
so
Leopold, I'm kind of confused. With all due respect, how do we target and select the centers to approach with our help? I mean, there might be as many as 5,000 retirees who depend on these facilities in our neighborhood, and I'm just curious, how do we approach them? I mean, we can't do every facility in every center, right? I mean,
you can do every facility and every center. You
we
call a
will.
meeting, Mr. Pruitt. We call a meeting, and that is how we did it. We call a meeting and then we sent a meeting invite to all the directors of the facilities who are in our district. Then they come to the meeting, whoever shows up to the meeting, they come, they sit with us, and we ask them, Mia, when is the budget time? When is the time that we have to put the budget together? Mia? I guess she's away from her phone. But
sorry, 1 second, Fran. I just taking a call. Give me 1 moment. I'm so sorry.
Yeah, so once you come back, I usually invite them to the board. The first thing that I did, because I didn't know too much of the facilities, I visited the facilities to see the condition of the facilities, because we have persons who are going there with disabilities and everything. And Ms. Martinez and I, we took a tour of the place, of some of the facilities, and we saw, they gave us a tour, showed us what their needs were. We spoke to the council members and the senators, and some of them at that time, Jesse Hamilton was there, and then he took a tour of Finnemore and some of the facilities. So when we know who they are, we have their address, and we know the directors, who the directors are, we get in touch with them and we invite them, and we sit with them and they let us know what their needs are. And based on that, when we are putting our needs assessment together, and then we have to put a budget together for the city, then we do the line items, and then we put all those different facilities and what the needs are. So if what is
the difference?
Hold on. Amir, go ahead.
I'm so sorry.
When this year are we looking at to put the needs assessment together for the community? Because I think last year we didn't do one for the senior centers. Since when we did it before, and then and I think,
well, the first thing that's open now is the city council discretionary funding application, in which funds can be solicited from the respective council members. And then after that, heading into the new budget, after July 1st, we spend the summer garnering all the information from our community partners, such as senior centers, to submit for the fall for the budget that will then be established as of next July 1st, because of course, the submission has already been made for the budget that will take effect July 1st, 2023.
2023, okay. Thank you very much.
Sure.
Yes, Mr. Pruitt.
There's a department in the city government called the Department of the Aging, or the Aged, or something like that. And what is it that we can do that they can't? I mean, it just strikes me that our target audience, our clientele, is greater than our resources. And
Mr. Pruitt, Mr. Pruitt, if you pay attention, I just spoke about Department of Aging earlier on. We are not pulling out any monies. The board don't have any monies to sustain, to do anything for this. Our position is to find out as to what the needs of those facilities, what are their needs. They come to us, they sit and say this. Some of them, as I said, Shalom said they needed steam tables, they needed chairs so that when the seniors come in, when they sit, they can raise their arms. When they're standing, they have something to support themselves on. The flooring was dilapidated, then they wanted to do the flooring over Some of them needed the stove, some of them needed refrigerators and stuff like that. Some needed stuff for when it comes to recreational stuff for the seniors when they come in for the day. So when they come in, they give us all this information, and all this information when we sit and when we put in the needs assessment together for the budget, then we add all those things in. And from there, it's out of our hands from there. Me at the office, they submit those things to the city. So then they just go to the different areas. Some go to the YCD, some go to the health, the different areas. And I think Mia can give a little bit more detail as to the different agencies, you know, and they respond back and said, okay, some of them, and hence the reason why we have to hear from them, because we cannot say we need tables or we need this or we need that. We have to be specific. We have to be more detailed and as to what the needs are for the facility, who needs whatever, and then they take it from there. Because when it comes back, it's just like a whole lot of paper, and then we have quite a few sheets of papers, and then we have to look to see where any of the agencies would have responded and who they would have granted monies to. And so we don't know. They don't send back to the board. And Mia, you can correct me. They don't send back and say, well, we sent money to Shalom, or we sent money to St. Gabriel's. Whatever that they do it on their end. We have to, go ahead, Mia.
Or they can simply say that we can't accommodate the request at the time. So essentially, Mr. Pruitt, what we do is try to help our most local on-the-ground community partners jockey for funding. So if a representative from a senior center says, okay, we need more tables so that we can conduct events. We have more members coming in, we need more tables. And that's a need. That's something that we would include in our budget request. That's something that we would then reach out to the respective council member, and solicit a letter of support to show that this is something that's important to the community, is garnered the attention of the community board, and has garnered the attention of the local council person, and they're supporting the service. So they know this is not just a basic ask. This is an ask that's being supported on the ground by the most basic community board.
I get that.
So
essentially,
Hold on, Mr. Pruitt, hold on. Go ahead.
So essentially, we're just helping them jockey for funding. It's not a guarantee, because essentially they can always establish their own agency priorities. Well, that would then knock anything out that we request or that we support on behalf of our community partners, because of course, for the larger agencies, they can always say that we have these projects that are longstanding that we're going to prioritize funding for. So basically what we try to do is just use our voice to show that it's just not this little center, you know, with their little ask list, that, you know, we try to show that there is support and they have support from the board, from the local elected official, and that, you know, they're not just a dot in the borough, they're on other people's, you know, list of importance.
Go ahead, Mr. Pruitt. Thank you, Mia. Go ahead, Mr. Pruitt.
I understand that, but how do we target or pare down the number of facilities that could use our help? I mean, we don't have a budget for.
Most definitely. I guess the committee can just make the decision to see exactly who needs additional engagement. I want to say that we've interacted with Blendman before, we interacted with Shalom. So perhaps we can explore relationships with some of the centers that we haven't been as active with in previous years. And I'm assuming during COVID and post-COVID, there's been a lot of turnover in leadership. So maybe we just need to go in and reintroduce ourselves to a lot of folks. And maybe that's what we should do, prioritize relationships that haven't really been cemented or, you know, or nurtured in past years.
Okay, all right.
So, Mr. Pruitt, I heard you quoted a number of 16 different facilities in the community. I only know about 5 really. So if you have a list of them and as to where they are, their addresses or whatever, I would be very happy for you to submit those to me.
I'll that up for you.
Yeah.
I just did a simple Google search under the postal code 11225.
Okay.
Yeah.
All right. Thank you. Good night. Yeah, thank you very
Oh,
much, Mr. Pruitt. Anyone, go
hi.
ahead, Cecilia, go ahead.
Oh, I'm sorry. I just wanted to circle back to what you said about maternal health, because there is actually a city initiative that Mayor Adams signed in. I think it has funding, I think, for 5 years or so,
Mhm.
where the city is providing free doula services to birthing people within, I think it's around 30 neighborhoods, and I know 11226 is included in that zip code. I can't remember the other ones because I'm in 11226, but I'm also one of the doulas in the program, where they're partnering with um, local organizations who do doulas and then take their doulas and assign them to people who are in shelters, people who are on Medicaid, um, to get the free services, and then the city actually pays the doula. So that is something that definitely, when we're doing the maternal health fair, that we can mention that there are these free services out there for people to take advantage of to help improve their birthing outcome.
Okay, so I'm throwing it on the floor right now. There were, well, I can say 8 of us here, including Mia, who makes up the 8. So I've called a few areas that I'm looking for us to work with. So I said the maternal health, we're looking at the initiative, bringing awareness, more awareness to the community when it comes to HIV/AIDS. And then we're looking at maternal health, and we're looking at the seniors and the youth. So these are 5 things we have on the table. Out of those 5, I don't want us to overwhelm ourselves, because we have our jobs, and then we have our own families, and I could speak for myself. I have all different other committees that that I'm heading and then I'm part of. So I don't want us to be overwhelmed. So out of the 5, we have a choice to choose 2 or 3 that we would like to work on for this year. Not for the quarter, but because it takes a lot of work, a lot of planning, especially if we have to get funding. So out of the 5 we have on the table, so we're gonna choose 2 or 3 that we could execute for this year. So the best ones win. We are working together, so I'm not making decisions. I want us to make those decisions by ourselves. So we are looking at maternal health, right? We are looking at awareness for HIV/AIDS. We are looking at seniors. We are looking at mental health and the youth. So, but I'm calling the first one. I'm calling. Okay. Do I have a chat? Okay, put it in the chat, and I will look at it. Whichever ones, out of the 5 that I called, either 2 or 3. We are looking at 2 or 3 that we could work with.
You remember the first day we met, the first night we met, there was a young lady here from the from Canberra. She had a project to teach the inoculation of amphetamines and that all of that stuff. What that would strike me as being a pretty heady engagement with the community, and we would actually be doing something that would stop overdoses and maybe save some lives once we teach people how to apply the spray. I mean the nasal spray. Not that I disagree with any of the 3 projects or goals that you established, but it seems like this project that the young lady had, and I haven't seen her since that day, that night. It seems pretty ambitious, and it would seem like something we could handle. I mean,
Okay.
we would have community meetings with various community boards and Cambria, what is that outfit called? Cambria, the Church Avenue Business Merchants Association. It was the lady who spoke the first night. The lady from Long Island. I'm sorry.
Was that Camden? Was that Camden? I don't remember.
Yeah. That seemed like, I mean, the drug addiction is still pretty serious in this neighborhood, and
Excuse me, Mr. Period, I don't want to cut you off. So there are I could say 7 of the board members now, so I only have from 4 persons. So I'm already gonna say from 4. So I'm missing for 2 because I didn't put in mine, and Mia, you can put in yours as well, because you usually work very closely, with the committees. So, and you are the office, you get a lot of calls and stuff coming in. So I'm waiting to get from 1, 2, 3, 4. I'm waiting to get from 3 more people. So far, I have mental health. Mental health is one of the top ones. Okay, mental health, seniors and youth. Okay.
what are you counting exactly?
And so I'm missing 2 other persons to give theirs. As to out of the after the numbers, the names that I call, which ones you would like us to work with? So I think let me see. Mia sent out hers. Okay, so I heard from Carla, I heard from Cecilia, Alexandra, Minor, and Mia. Mr. Almana, did you send yours?
I didn't send mine, no. My interest will be mostly the youth.
Okay. Okay, so youth. So Mr. Pirate, I hear you, but these are those persons that we will have to try to connect with them, and which is a very important program. They haven't, and I was really looking forward to working with them, but they never came back again, because I did ask for them to join us to work with us so that we could really push that initiative, which is very important.
I was unaware of that.
Yeah, so so based on what we have on the table now, can you give me the which ones were you what we have not right now on the table that we can work with?
Well, I too would like to go with the youth program. But once again, we face a
But remember, I don't want to cut you short, but remember, whatever that we're doing with the youth, we will not be setting up anything for them. It's just if we have any suggestions or any programs, anything that we want to do with them, we have to liaise with the youth committee, because we have the youth committee on the board, so we cannot bypass them. We have to bring it to them. It is not an initiative that we'll just take on our own and run with it, because we have a youth. We have a youth.
I want to also say the education committee also.
And then also the education, the education committee. Okay. So I'm looking at 1, 2, 3, 4, 5. So for mental health, I have 5. For seniors, I have 1, 2, 3, 4. So I have 4 for seniors. The youth, I have 1, 2, 3, 4, 5, 6. Then maternal health, one. So for maternal health, I have 1. Well, really 2. And for HIV, 2. And then mental health, 6. Okay. So the runnings are mental health, 6, seniors 4, the youth 5, and we're gonna make seniors 5 because I vote for seniors. So then therefore we are looking at mental health, the seniors, and the youth. So these are the 3 main ones we have on the table: 6, 6, and 5. These are the 3 main ones we have on the table presently. The youth, whatever persons or whoever persons on this platform right now, if you do have, we will look at programs that we want to bring in, especially stuff to, I don't want to speak much about it because there's quite a few things that I would like to see happen, but we will meet and liaison because Mr. Almoner, you're on the youth committee, right?
Youth is correct. Mhm.
Right, and there are a few things that the hospital have been talking about, so I'll get some more information and bring it back and see how best we can work with the youth committee and the education committee. And because I would really like for us to, we have schools in our community that we can bring programs to our schools to educate them. And we have, we look at obesity in the community. You know, we have young kids who are suffering, who already are diabetic, you know, so I would really like us to go to the schools and even the weeks that they have parents, teachers, you know, to have a forum, bring in somebody, a health person who can bring in, who could come in and wait. There was this young lady who came in and then she spoke about healthy cooking and going to the schools and teaching the parents how to cook healthy for the kids and even teaching the kids to cook healthy as well. And they enjoyed it, they like it, so that when they are home that, you know, they will, you know, because when you look, when I sit on I take a bus and I see a 11-year-old child or 9-year-old child sitting on the bus and she is out there, she's huge, you know, and she have a plate of sweet and sour pork eating and chips on the bus at her age, you know, so I know, I see where she's heading. You know, I see where she's heading, and so we need to do something. We need to bring some awareness. If they already have awareness at the schools, we need to double up on it and bring some more health education to the schools when it comes to our youth. The mental health, we will be discussing the mental health as to the forum. So we will talk to, we'll have most likely the next meeting we have next month. I'll see if one of the council members could join us, who is very much into mental health, and even with the youth. Council member Rita Joseph, she will be very interested in that program for the youth.
You know,
Because
one
she
thing
as a
about
profession,
one thing
a profession as a
about
teacher, that's what she would like to hold on a minute. I'm so sorry, it's 8 o'clock already. I don't want to hold you back, Mr. Pruitt. You were asking a question?
yeah, I was going to say, man, I forgot what I was going to say. Oh man, I forgot my point. I'm sorry about that.
No problem.
I'm sorry about that.
No problem at all. It happens to the best of it. It happens to me all the time. So as I was saying that, I'll see if I could bring on for the youth, whatever that we're looking to do, to liaison with Rita Joseph. And also she's very interested in what's happening with the seniors, and because there's some meetings and conversation I've had with the council member as well as the assembly member, because we can do it on our own, and then I know they have other organizations that they partner with, and then whatever else that we may need, to push it, that we'll be able to get the help with. So these are the three areas.
I know what I was going to say about mental health. You hear a lot of stuff in the newspapers these days about how health insurance does not cover mental health, and how people are committing suicide, and their primary doctors might have known that they were ill, but they didn't pass that on to a psychiatrist or a psychologist. And so maybe a form whereby we could put pressure on these life insurance companies, these health insurance companies, to attend a meeting to discuss what will it take for healthcare services to cover mental health and depression and mental illness and that sort of thing. Do you think that would be worthy of our time?
We can do that, because there are a lot of many a times we have Health First who came on the platform, who presented what they do in the community. We've had I think Metro Plus, they came. So we had some of the insurance companies who attended our meetings, so we can ask them to come. Maybe not all of them, but ask one of them to attend and hear, what type of coverage, and see what could be done. We can do that as well. Okay, so these are the three areas, and when it comes to the senior centers, we will target. I will get Mia, if Mia can give me a list of the block association presidents, because they are the ones that we could really liaison with to get information on the seniors in our community, and then all the tenant association people also, presidents also, we can liaison with them, and see what is needed, because we are targeting the senior centers, but we also have seniors who are at their homes, and they still need services, they still need things done for them. So we have, when it comes to the seniors, it's big. It's a big thing when it comes to the seniors. And as I said, with the youth, we will be working very closely with the education department and the youth committee, to see where we go with the program when it comes to schools. Because I know that Primo, he have connected with some of the schools already. So so these are the three things we have on the agenda for the year. They are big, and then we don't want to overwhelm ourselves. So I know we have more persons on the committee, but I think that our committee is quite small, so we have to collaborate together, put our heads together, and work on those together. Okay? So whatever information you have, whatever ideas, as you lay down in your bed or you're walking or you go someplace and you see something or you hear something and you think something that will be beneficial to us to move those projects along, please bring it back to the next meeting or email me. As I've said before, we were supposed to do it in 2022. We didn't do it, but I will set up, I am assuming that Mia has the telephone number for each person here. So I'll get your numbers and I'll create a WhatsApp chat. And then so we'll have a chat. So and we'll communicate through there. Okay?
Okay.
So Mia, if you can, you know the persons that I want to be on the committee, this those who are here, those who are part of the committee and the ones that I had before. So you can send me their telephone numbers so I can add them into the WhatsApp chat. All right, so we started at 7:05, so we're gonna end at 8:05 promptly. I just want, if anyone else, anyone have any comment before we go? No? Okay. So I just want to thank each and every one of you for being here. Remember to be safe. Take care of yourself. Cecilia, please do take care of yourself as you go out there. You know, take care of the little one, you know, and
Sorry.
I see.
Oh, thank you. She wanted to hop on my lap. She's like, "Oh, call Gigi." I'm like, "No, I'm on the phone." So she wants to
Yeah.
You a hug.
So have a good night, everyone. Stay safe. And Mr. Pruitt, thank you again. So safe, everyone.
Okay, good night.
Good
Good
night,
night,
all.
Good night, everyone. Bye-bye.
Bye.
Good night, everyone. Bye-bye.
Good night.